Well, good morning, guys. This is Dr. Sean over at FORTIS, and this is Terminology Week 3. We're doing the overview and review, the learning outcomes and stuff for this middle of the term. Now, there is a midterm in the middle of the term, which is obviously where you put it, right? So I'm going to go over that in another video, but this one I want to go over some basic stuff and get you prepped and get your mind kind of juiced up and ready to go. We're going to talk about things like this guy, this section this week, and that's cardiovascular. So one of the cardiovascular things we're going to talk about the chambers of the heart, the parts of the outside of the heart and the parts of the inside of the heart, and that would be the valves and the chambers and the atria and the ventricles and the what are they called? The chordae tendineae, which are the little wires that hold the valves open. I'll tell you my story about that because I do have a valve issue that I'm looking to get maybe repaired in the next few months. And things like the aorta and the vena cava, and then the coronary arteries, the coronary veins, and things like that. So get in that idea of having those words. We're also going to talk about hematology. Hemato means blood, and ology means the study of. So the study of blood. So things like your CBC, your complete blood count, which is a blood count that you can get when you have blood drawn through phlebotomy. Phleb, right, is actually has to do with the veins, and otomy means to cut into, to poke into. It really is like putting holes in your veins. Complete blood count. You have the hemoglobin, which is the amount of is a protein that holds onto oxygen. Actually, hematocrit, which is the percentage of blood occupied. Well, actually, is the blood volume occupied by red cells. How many red cells do you have? So when you get a little, like a vial of blood, this is a vial. This is lotion, actually. No, not lotion. Oil. So when you get like a little thing, and you can see like right here, it'd be like red stuff, right? And then above it would be this clear stuff. The clear stuff is the plasma. Plasma is the liquid form of blood. The dark stuff, the red stuff, that's the whole blood connective tissue, which is your, not whole blood, that's the hematocrit, right? Those are the red blood cells, the erythrocytes. Cytes means cells, erythro means red, okay? And then you get into things like neutrophil counts, or white blood cell counts, and leukocytes, and all of that kind of stuff, and then you get into thrombocytes and those guys. We may talk about, or you're going to see things about anemia. You think of anemia, and you think of someone being kind of a little pale or tired. That's iron deficiency, right? They don't have enough iron. Not uncommon in females, especially if their diet is poor, or not terrible poor either. I mean, just like a little bit poor, because they go through a monthly cycle, and you lose some red blood cells during that, and that loses some of your iron, and you may not replenish it if you're not eating a lot of good foods. So that's another one. Hematopoiesis, hemato again, blood. Poiesis means development. This happens in the bone marrow of the big bones, like the shoulder and the hip and stuff like that. In the red marrow of those big bones is where we have hematopoiesis take place. That's how to grow blood cells. Hemolysis. Lysis means to break apart. Okay, just to tear apart. Hemolysis means blood breaking apart. Hemostasis, stop bleeding. So we go through an entire thing. Usually it's direct pressure, right? So if you get a cut or something, you put direct pressure on it, and the thrombocytes and fibrin, or all of this stuff will get in there, and it will cause it to clot up. We are going to only do this for about one more minute, and then I'm gonna go on with stuff. Other learning objectives, we're gonna get into things like the lymphatic system, lymphoma, leukemia. And what is the other thing here? Like infections, immune system. So immune system, you are going to talk about B cells and T cells. B cells, born in the bone marrow. T cells, out here in the thymus, actually. This is down here, not the thyroid. Okay? So anyway, this is Dr. Sean over at FORTIS, and there you go. Week 3. I'm going to sneeze.